Another frequently asked question that I get from patients is, Dr. Young, what are my options to replace a missing tooth? Starting with something removable, a flipper or partial. Replaces a missing tooth, you take it in and out. Next, something permanent that stays in the mouth, a bridge. A bridge is literally that. You have a space between two teeth and you bridge the gap. It's a series of crowns that are all one connected piece, and it bridges the gap and restores function. Bridges sometimes are good, sometimes they're not the best option. If you have a tooth that's severely weakened and the tooth would benefit being strengthened by a crown, then a bridge is a good option if that's what's going on with those two teeth you're going to use. Let's say though, when is it not a good option? If you've got a perfectly healthy tooth that's never had a cavity in it, never had any kind of a filling or dental restoration, you really don't want to take perfectly good, healthy tooth structure away, and that's where an implant comes in. An implant is the most like a natural tooth. The way an implant works is once a tooth is removed and the bone heals, then an implant is placed. The implant takes time to heal, it becomes fused to the bone, it becomes incorporated into the body. One of the functions that a tooth serves is when you chew, the body is stimulated to reproduce bone. When a tooth is lost, that stimulation's gone. An implant will do that again. Once the implant's in there and you restore function, now the body is stimulated again to reproduce bone around that implant.